Hello everyone. Today, we're diving into the world of a medication called Ivermectin, commonly known by its brand names Stromectol, Soolantra, and Sklice. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Ivermectin is an antiparasitic medication primarily used to treat various parasitic infections. It belongs to a class of drugs called anthelmintics, which work by paralyzing and killing parasites. Initially approved by the FDA in the late 1980s, ivermectin is used to treat conditions such as onchocerciasis, river blindness, strongyloidiasis, intestinal infection caused by a type of roundworm, and scabies. It is also used topically to treat head lice and certain skin conditions like rosacea. For systemic infections, ivermectin is taken orally in tablet form. It has shown effectiveness in reducing the prevalence of these parasitic diseases, improving the quality of life in affected populations. When used topically, it can help manage symptoms of rosacea by reducing the presence of inflammatory lesions. It's important to note that ivermectin should only be used for the conditions it is prescribed for and under the guidance of a healthcare professional. Warnings: Ivermectin comes with its set of precautions. It's crucial not to use this medication without proper medical advice, especially for conditions it is not approved to treat. Misuse can lead to serious health risks. It is not intended for children under a certain age or weight without explicit medical advice. Those with liver issues should be cautious, as ivermectin is metabolized by the liver. If you have a history of allergic reactions to similar drugs or to ivermectin itself, inform your healthcare provider before taking this medicine. Before starting ivermectin, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug. Given its impact on the liver, those with liver diseases or conditions should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. You should not take ivermectin if you have a history of severe allergic reactions to it or if you have certain medical conditions that may interact adversely with the drug. It's important to inform your doctor about any pre-existing conditions such as liver disease, asthma, or any other chronic illnesses. Also, disclose if you are taking any other medications, including over-the-counter drugs, supplements, or herbal products, as these can interact with ivermectin. Side effects: all medications can have side effects, and ivermectin is no exception. Some individuals might experience mild side effects such as dizziness, nausea, diarrhea, or mild skin rash. These symptoms often resolve on their own as the body adjusts to the medication. However, there are more serious side effects to be aware of. These include severe skin reactions, liver injury, and neurological effects such as confusion or seizures. In rare cases, ivermectin can cause an allergic reaction with symptoms like hives, difficulty breathing, and swelling of the face, lips, tongue, or throat. Seek immediate medical attention if you experience these symptoms. Interactions: ivermectin might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. For instance, drugs that affect liver enzymes might alter the effectiveness and safety of ivermectin. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking ivermectin. The dosage for systemic infections usually depends on the patient's weight and the specific condition being treated. For oral administration, it is often taken as a single dose on an empty stomach with water. For topical treatments, follow the specific instructions provided by your healthcare provider. The dosage may vary based on the condition being treated. For example, in the case of onchocerciasis, a common dose might be 150 micrograms per kilogram of body weight, taken once every 12 months. For strongyloidiasis, the dose might be similar but given as a single dose. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid: while on ivermectin, it's advisable to avoid alcohol, as it can exacerbate certain side effects such as dizziness or liver issues. Given the potential for dizziness, it's wise to rise slowly from sitting or lying positions to prevent falls. FAQ: many wonder about the age restrictions for ivermectin. Its use in children under 15 kilograms or those younger than 5 years is typically not recommended unless directed by a healthcare provider. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of ivermectin. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.